join the revolution starting inside. An instrumental part of Agora worldwide. Agora worldwide, Agora worldwide. Counter economics, Agorist strip. Black market click, move a quick flip. Can't regulate this, Agorist strip. Black market click, move a quick flip. Can't regulate this, Agorist.
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 Nexus, Agorist.
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 Hey guys, it's the Agorist Nexus Podcast. I am your host, Dag. We've got a great episode for you today. Before we get into it, let me go ahead and give a big shout out to our sponsors, Presearch, decentralized search engine, no spying, no censorship. It's just a cool project. Get free crypto just for using it. Really, really neat. And if you want to go ahead and set up an account with them, be sure to do it through our affiliate link, agoristnexus.com/search. And that way they know that we are worth sponsoring. So without further ado, my guest today is John Osterhoudt. God, I hope I said that right. How you doing today, John?
I'm doing well. You said it mostly right. All it needed was a little bit more confidence.
Yeah, probably. My last name is crazy in German, and I know we don't pronounce it properly. So, we do our best, though, right? John is
my last name has been thoroughly Americanized because my paternal line has been here since before the revolution, and we can prove that with the records. So, we've got it Americanized.
That's kind of neat. Mine's I don't know, a generation or two. I don't know if anybody has ever said it correctly. I don't think they cared. But I never cared about my family lineage. I'm like, whatever. I was born in America. I'm an American. Whatever. But then it's like once my family did all their DNA tests and sort of found out a lot of history, I was like, oh, it's actually pretty fascinating. And I found out a lot of my family's actually been here since before the country was founded. So.
Well, we're recording on the 4th of July, so I feel like I have to bring it up because my ancestors, they were fighting in the revolution, and we have the documents to prove it. And my great grandfather did that historical work because he was he had to go to live at an orphanage during the Great Depression because his parents couldn't take care of him. Mm-hmm. And so after that, he did a bunch of in his adulthood, he did a bunch of research on his lineage. And then, my grandfather was part of the Sons of the Revolution. And in order to be part of that, you have to be able to prove it. The Dutch were fighting up in New York, formerly New Amsterdam, before these English bastards stole it from us. And now I'm in Florida. But anyway, I've totally derailed this, and you were going to introduce me like a normal podcast, and I just went off the rails talking about my historical line. But I'm just proud to have fought off the redcoats in my past lives.
That's excellent. So in my family lineage, not the German side, they were French, lived in Canada, and they got expelled because they kept murdering and scalping British people. Them and the Native Americans would team up and and murder and scalp British people. So they got expelled into the colonies, and so then they came from Maine. So actually, kind of interesting there. And again, fuck them Brits.
It's the perfect day for it.
It is. Oh shit, man. Yeah. See, so this worked out, man. It was a perfect derailment. Yeah. I'm not mad at all. So let's go ahead and get back to it, I guess. John, you're a producer at Reason TV. All around cool dude. We've actually met in person, and it's definitely been a pleasure. So I appreciate you coming on today. The reason that I'm bringing you on, this wasn't meant to be a theme. My last episode was about the medical industry as well, but we're going to talk about direct primary care. I heard you on an episode of the Tom Wood Show actually talking about this, and as Agorists, we try to find any way we can to, just avoid the general government-laden industries, wherever possible. One of the more difficult ones is actually, medical. It's something that, I like black and gray markets as much as the next guy, but I kind of want my dentist to have a license. You know what I mean? So it's one of those things that can be a little harder to avoid, but this is actually a really cool way that you can get around some of the, I don't even know how to call it, a medical tyranny that goes on these days when it comes to just how you have to be so involved with insurance companies to even get medical care. And then, of course, we'll get into it, how prices are driven up, et cetera, because of it's extensive bureaucracy. So go ahead and you did a video that we'll link to, which is really great. I recommend everybody watch it. It's not super long or anything. It's not super short. It's really good. So I recommend that everyone check it out. We'll link to it. But go ahead and tell us some about yourself or direct primary care or, whatever.
Yeah, well, I think I've told you guys enough about myself so far, my hundreds of years of my family background. So let's just jump right into direct primary care and, fitting with the raison d'etre of your podcast. I think this is not a perfect model of agorism because, it's legal. And I know you guys don't like legal stuff, but
hey, markets are markets, dude. I'm just saying, if we have to venture into black and gray to make shit happen, that's what we do.
Yeah. Well, it's definitely a secession from the status quo. And what direct primary care is, it's a very simple model of getting healthcare from a primary care doctor, which is you have a subscription model and generally you pay monthly and you have a direct relationship with your doctor. Usually you pay somewhere, the average is between $50 and $100. And my wife goes to a direct primary care and hers is actually $42 a month. But the office that I highlighted in my video at Reason was $75. But what you're getting for that monthly payment is essentially unlimited access to your doctor, and you have a direct relationship to them. There's no insurance in between you, and pretty much all of your primary care needs are going to be met at no extra cost after you pay that membership fee. And so that's going to include everything from just your normal checkups, getting, making sure that everything is all right every year. But they can do stuff like stitch up wounds, splint uncomplicated fractures. They can give you, various shots and vaccines and pretty much anything that's non-emergency or, most of the stuff in your life that you need done can be done at a primary care level. And most of these doctors are, family medicine or internal medicine. And what this means is that they have very broad training. So now they can actually give you most of what you need in the healthcare field. And that's true of all primary care doctors. But the difference with direct primary care is that because they have this membership fee, they know exactly how much money they're making every month. They know what's coming in, and they don't have to worry about trying to cram as many visits. So at a traditional fee for service, they're just charging you every time they do something to you. And what that means, in order to keep their business afloat and to keep up with the costs of all the insurance bureaucracy, they actually need to have as many people come in every day. So, most people are probably familiar. If you go into just a regular doctor's office, you're not going to get very much time with the doctor. You're going to be waiting around a lot. And they're pretty much in, and when they come in the room, they're just on their computer. This has been my experience at pretty much every doctor I've ever been to, except when I was doing this direct primary care stuff. And like I said, my wife uses this, and that's her experience as well. It's just better care because there's no one standing in between you and your health medical provider. So when the doctors are dealing with insurance companies, it's not exactly clear that they're working for you. A lot of times it feels like they're working for their insurance company. So this is a way to secede from that insurance status quo and kind of develop direct relationships with your patients. And so that's the basic model of it, and that's how it works. And so the key here is that they don't accept insurance and they don't accept Medicare. So they just are kind of going out on their own and creating a new field. And this is actually fairly new. I mean, people have only really been doing this for like 10 years. And it didn't have a name at first, and it's kind of just spontaneously developed. So now there's, I think, close to like 1,400 or so direct primary care offices in the country.
You say like it's like a new thing, and like it kind of is, but it almost feels like it's like going back to like more like the olden days, right? Like you have like a doctor who handles, most nonsense you're going to deal with, and he's, like when I grew up, like we had, like our primary care guy, and he was, it was easy. He knew the family, he knew, everybody. So he knew the family history. So whenever there were new kids, he was able to take care of things. But primary care doctors are just in such like a weird position right now with like, especially with the whole insurance thing. So like my experience, exactly like you were saying, the doctor comes in and he barely looks at you. He's filling out blanks on a laptop. I assume that's what he's doing. I don't know, but he's typing away the whole time. And it seems like he's just checking boxes. And then it's just my insurance company. They just use, like, I don't even know what the purpose of the primary care doctor is. Like, I don't need to see a regular doctor often, but I have a heart condition. So I need to see a cardiologist. And just recently they were telling me I couldn't go see my cardiologist until I went to a primary care doctor, and got like a referral. And it's like, dude, I've been going to my cardiologist twice a year my whole life. Like, I don't need some dick with a stethoscope to tell me I need to go see my cardiologist. Why do you, it seems like a waste of resources, a waste of time, just all around. So it's just, primary care doctors in a really weird position right now. So this just seems really great because, I mean, if you live a relatively healthy lifestyle, you probably don't need to go very often, but you want it available. You get you get sick, if you just need some antibiotics or something, you need to go in, blah, blah, blah. And I have had experiences in the past where I didn't have insurance and you go into a doctor and say, hey, I got cash. And they're like, oh yeah, cool. $60. Let's do this, Yep. And it was a much better deal.
Yeah. I just did that recently. So I have insurance and I use it most of the time, but I recently broke like 3 bones skateboarding. And so I've been dealing with the medical system quite a bit recently. And I had a thing where I needed to know if I needed to have surgery on my right wrist, which I broke. Luckily I don't, but I had to get a CAT scan to figure that out. And it was somewhat timely. They wanted me to get this scan done pretty quickly because, if I need surgery, they would want to do it, as soon as possible. But in order for me to get this CAT scan using my insurance, there was like a 5-day waiting period on the insurance, which is, great if you're in Canada. But when you're supposed to be free, you should just be able to buy the stuff when people want to sell it to you. But the insurance company is telling me to wait. So I just said, what's the waiting period if I just give you cash? And, it wasn't a bad price. I think that I paid like $250 for a CAT scan, which is it's not bad at all. And I went in the next day. And so if you get these giant bureaucracies out of the way, there's so much more is possible. And you can have a much better relationship with the people giving you medicine because all of the insurance rules are terrible. And it's never the people working at the front desk's fault, but who else are you talking to? And so it just makes you kind of resent those people and you get this bill in the mail later. You don't know what things are going to cost. It's just a bad experience. Totally not capitalism, totally not markets. And direct primary care is actually basically just introducing markets into the medical system where they haven't existed for a long time. And so to get to your original point there is that it is actually kind of a callback to how these things used to work. So before World War II, this medical insurance bureaucracy to pay for everything didn't exist, because right now the way we're using health insurance would be the analogy I always use is it'd be like using auto insurance to get an oil change or to fill up on gas, just routine stuff that you always have to do. In the medical industry, we're using insurance for that. So it just puts more people in between you and the stuff that you need. And it drives up the cost. It makes the experience worse. And the reason this originally happened was during World War II, the IRS they changed the tax laws so that if your employer bought you medical insurance on your behalf as like a benefit, that would be pre-tax. But if you waited until after they paid you to buy your own medical insurance, that would be post-tax. And so it'd be more expensive. Obviously, the incentive is set up so that employers, start paying you with benefits. And we've actually seen that, benefits have gone up a lot as far as like how people are paid. And you can see this a lot of the time. There's like trouble when you try to say like, well, the middle classes, their quality of life is going down and wages are stagnant. It's like, well, when you actually account for like the amount of money that employers are spending, giving employees benefits, those numbers have gone way up. So it's difficult to measure, but a lot of times those benefits are kind of worse than they need to be because of this like insurance model. And then once this thing started where people were using insurance and everyone was getting healthcare through their employer, in the 60s, I think it was, they were just like, what are we going to do for people who don't have a job or they're retired, whatever? Well, we need a government program. And so Medicare came along, and Medicare is basically just government provided health insurance. And that totally just, they dominate the healthcare market. Pretty much all of the private so-called insurance companies conform to what Medicare does. And so really the whole thing is one big corporatist government program, and that's why it's so terrible. And so the direct primary care people said, why are we doing this? Why are we using insurance to pay for stuff that is not an emergency? We know what it's supposed to cost. There's no reason people can't shop around. And they said, we're not going to deal with this system anymore. So we're just not even going to accept it. You know, you have Medicare, can't, you know, you want to use it, don't come here. But a lot of times it is much cheaper to actually just pay the doctor directly, even if you have health insurance.
You know, I got a lot of respect for the doctors who see that problem, because I'm really getting to the point where it's like I have very little respect for doctors who are working within the big bureaucratic system. But I mean, I get it. You go to medical school for, 10 years or whatever, and it's like you want to be ensured that you're going to have a job and this and that. So having to go be a businessman as well as a doctor can probably be a little intimidating. But hopefully when more people start doing this, it'll, more people will start doing this. So it probably also gives them just a lot of
I think the main part.
Go ahead.
Yeah. Doctors love it. Doctors love it. Once they find out about this model and they adopt it, their quality of life goes way up. That's something that I've heard time and time again in researching this way of doing business, is that doctors just love it because you stop dealing with Medicare all the time. You stop dealing with insurance agents, and a lot of these doctors' offices, they have a doctor, maybe another doctor. If there's it's a larger office, they have two people working out of the same building, and then they just have like a nurse, and they kind of just do schedule, and everything the nurse does is like just dealing with patients. Like there's no one there whose only job is to like deal with billing and stuff like that. It's just like they can have one or two people running the whole doctor's office, and they don't need all this extra stuff that just drives costs up. So that's why it's so low. Like the doctor my wife goes to, it's $42 a month, and it's just the doctor. And I think he has like one nurse, and they're just there, regular business hours, and they don't have to deal with insurance bureaucracy. So their job is a lot easier, and they know how much money they're making every time, and they can spend more time with the patient. The patient knows what things are going to cost. So there's no resentment, there's no guessing, no surprise work. And it's just a way for doctors to do what they originally wanted to do, which was just help people and deal directly with patients instead of dealing with bureaucrats and insurance companies, or even worse, in Medicare or Medicaid.
So what happens when somebody needs something beyond like primary care, something, sorry, I don't know if you can hear that my hound dog's going off. Hold on a second.
Yeah, I can hear.
Sorry, give me a second.
But yeah, so they
okay,
do you want to pause, or could you just go?
No, okay. No, I think we're good. My wife got him.
Okay.
So yeah, somebody goes beyond
if you need blood work done or x-rays done, yeah. So if you need blood work done or x-rays done, what pretty much every single direct primary care office does is they have developed relationships with other forms of other medical companies, basically. So imaging companies, radiologists, blood labs. And basically how it works at the one that was in my recent video is they have a relationship with a blood lab. We'll just take that as an example. And every month the blood lab says, okay, Dr. Lee Gross, you've sent us X amount of patients this month, and this is how much it costs. And Lee Gross basically just collects the money from his patients and sends it over. And they do that every time. So the patient is like, if I need blood work done, I know it's going to cost me $50, and that's how much it is. I'm not going to get any surprise bills. I just pay that. And then Dr. Gross ends up getting it to the blood lab for me. And there's other things where it's like, if you go to an imaging company, his patients get a special deal with the imaging company where, they get $15 x-rays or whatever they need. Right. And so that's the way that a lot of it happens, is just through direct relationships that your doctor set up for you, basically on your behalf. He set up this stuff for you. So if it's not emergency, that's the way it pretty much works. And even if you need some surgery, so like the same doctor's office here that I did in my recent video, they have a relationship with a hospital, DeSoto Memorial, and the hospital pretty much has cash prices for all their surgeries now, for all like the basic surgeries. So if you need a knee replacement or any kind of stuff like that, Dr. Gross can send his patients to that hospital, and they can pay with cash without needing to deal with insurance, and they know exactly what it's going to cost. They have a direct relationship with the surgeon and all the medical team that's helping with their surgery. And so that's a way you can do surgeries and stuff like that. And I'm sure you're familiar with the Oklahoma City Surgery Center. They do this. It's just this It's just a surgery center, and they don't take insurance. They don't. All they take is cash, and so they have prices on their website. It's like if you need this kind of surgery, you can basically just shop it around because this is how much it's going to cost. So that's kind of the way that a lot of that gets done, is through relationships between people in the local medical market, basically.
And, again, as this sort of thing picks up, I'd have to assume that other sort of like specialists who cater to this kind of thing will probably pop up, or business models, because it's got to be just, even for like the blood lab, for instance, it's got to be easier for them to deal with this kind of thing too. So I really hope that, I can really see, things like that picking up. So let's say you have a metropolitan area and you have like a blood lab that deals for all these people, and, it can probably just really blossom from there, which should be pretty cool.
Well, just an anecdote on that is the blood lab that Dr. Lee Gross, the one in my video, deals with. They're seeing like 90% discounts on the labs that they provide. So if you were to pay for it with insurance, the cost would be, 90% higher than if you were to pay for it with Dr. Gross. And the reason that is because when you go through Dr. Gross, the blood lab doesn't need to be filing everything, talking with the bureaucrats, calling customer service, whatever they have to do. When you don't have to do that, the cost comes way down. It comes down dramatically. And so, and if you don't have to deal with that, and you can make the same amount of money, or you can draw people in by having lower prices, that's going to be good for your mental health, and just your sanity as you try to run a business. But it's also going to be better for the patients as well, because they know what things cost. It's going to be lower. And so, just getting that insurance out of there is actually just in and of itself one of the things that makes this whole model of healthcare so much more efficient and affordable.
Hey guys, quick pause here to tell you about our sponsor, Devault Cryptocurrency. Ticker symbol DVT is a low cap coin with a market cap around 900,000. So there could be room for opportunity here. Not financial advice, but we really like this project.
Yeah, the Devault core wallet is one of the best I've ever seen. Very user friendly, super easy to use with cold staking rewards. So it's like getting interest. They're working on privacy with Terraform, also DeFi to decentralize and replace financial institutions.
So go ahead and check them out over at devault.cc and get you a Devault core wallet today. Also, be sure to check out the show notes to find exchanges that they are traded on. With that said, let's get back to the show.
I feel like in let's say a perfect world, or not quite that far, but a stateless world, a world without this medical bureaucratic nonsense.
Yeah, or even if we just had basically the same state, but they're not involved with the healthcare industry.
Exactly. So I feel like what would be ideal would be okay, you have a direct primary care that handles the vast majority of your medical stuff, and then you have a catastrophic insurance policy, right? Something that just something really bad, right? Now, its
only purpose would be to protect you from financial ruin in the case of a medical emergency. And those plans would be, they're way cheaper compared to the prepaid plans you get through your employer or whatever.
Are they legal anymore? I thought that
well, Obamacare pretty much made them illegal. They're only legal for short amount of time, I think. So if you are unemployed for 6 months to a year or something, you can kind of be on this transitional insurance policy that only covers outright emergencies. But in the long term, you can't just have that. No. And so some of the ways around that, actually, even as we speak right now, is to do things that aren't technically insurance companies, but they're sharing ministries. So a lot of them are religious. You pay a certain amount into it every time. And basically what happens is when a member needs surgery or something expensive, you just share the costs throughout all of the members. And then, if you're the one, it turns out that you have a heart attack or something and you need surgery or whatever the case may be, then you just share that cost among all the people in your ministry, and they're literally just sharing it. So that is something that happens right now. And a reason it's done videos on that. If you look up sharing ministries, you can learn more about it.
Yeah, I've heard of those. Oh, I forgot about them. You mentioned about health shares or whatever. That's really cool. So let's move on to another scenario. So and this one is, I'll just say this is my scenario. Okay, so I was born with a heart defect, and I have required and will require surgery. It's planned, like we've known, for decades, like the schedule, So obviously I'm going to pay more for healthcare than the average person. That's fine. I just, wanted to be, affordable, which I feel a market could, make it as such. But so let's say I have, a big expensive surgery that I'm going to need, right? Like what might be in a more free market kind of style, what might be like an approach to something like that?
Well, I think one approach would just be that you could share that cost with others. If you were in a sharing ministry, I mean, that's the whole purpose of it. It's not just for emergencies, it's for big financial hits, right? That's when people would in your ministry would help you share. And that's when you would help share with other people when they had that kind of thing. So in order to just, kind of divert some of that direct cost, it could be something like that where you have, you're just part of this financial sharing. And then, or it could be a case where, I think it would have to be that, because if it was an emergency heart surgery or something, then that would be a case for insurance, because, it's unplanned and that's the exact type of thing that you insure yourself for. But when it's set out in advance, I think the model would look something more like you'd be able to shop around with different surgeons. They'd help get the price low. Right now you only have a couple options. You could maybe go to DeSoto Memorial and ask them, what the cash price is. Or if you wanted to go to Oklahoma City, you could just go to Keith Smith's Oklahoma Surgery Center and know exactly what the cost is going to be well before you need to do it. So it kind of, even just knowing, even if the cost of the surgery is going to be still pretty high because, whatever kind of surgery it is, that's just the way it works. At least exactly what the price is ahead of time, so you can plan and you can make deliberate sacrifices in order to meet that cost. Yeah, you can save up for it. Yeah, and not just
I'm thinking
general.
Like Oklahoma City, like the surgeons, and they might even have like because this is something I've known for 20 years. Hey, we go I make monthly payments to them, and then they can do like ahead of time to build up something, or even because the way that a lot of insurance companies operate, if I'm not mistaken, is they don't make money off of premiums. They take the premiums and they invest it, and then that's their actual profits, is the profits they get from investing the premiums before they have to pay them back out. Or at least I think that's how some of them function. So it's almost like there could be, a similar kind of thing, hey, you pay into this at a lower rate, but you get more of a return because it, something I'm sure somebody will come up with something. So there's
there's actuarial scientists out there to do the calculations and, see what the risks are and give you a price. So
yeah. So that could be another sort of, I don't know, it's not quite an insurance model, but some sort of hybrid. I don't know. It's interesting.
Yeah. Well, it's not that insurance per se is something that in a free society people would not have. It's just that
I think insurance would actually run a lot of stuff in a free society.
Yeah, exactly. I agree with you, because that's kind of like, on its face, that's kind of the justification for government. It's like, if everything went well all the time, we really wouldn't need this institution to keep order or adjudicate disputes or whatever, So the role of that kind of a governance institution in the marketplace would just be, insurance. It'd be like, we're here to protect against security flaws or whatever, to keep insurance costs down. And it's the same thing. Or even more simple than that. We could just look at, you need auto insurance in case you wreck the car, right? So you're going to have auto insurance. And in fact, it's probably going to be your auto insurance that makes sure you know how to drive. It's not going to be the Department of Motor Vehicles.
Yes.
It's going to be USAA, or it's going to be, State Farm, or, the Duck, Aflac, and someone's going to make sure you know how to drive before they say, yeah, we'll cover you in the event of financial loss due to someone hitting you or whatever.
Just like liability companies for business. If you want to open a restaurant, the liability company would have direct interest in making sure you practice proper food safety and stuff like that. So that takes the place of, the health department, which sucks, and same thing with anything, building inspectors, I know a lot of people, when they have a new house built, the county comes in, inspects everything. Okay, everything's good. And then they bring in a private inspector and they're like, no. There's all these other, problems. So it's I definitely recommend, if you're having a house built, get a private inspector, because I know a lot of people who have saved a lot of money and headache by doing that.
And what you were saying earlier with like the dentist, you said that you wouldn't want to go to a dentist that wasn't certified, and right now the certification is very like statist and whatever, but that would be the same thing. If you were, we do that with literally everything that we do right now. Like if we want to go out for dinner to a restaurant we've never been to, what do? We see what people are saying about it. We go on Google and we see what the rating is. We read reviews, we go on Yelp if we trust that more, whatever. So it'd be the same thing in the medical field in a free market. And to some extent, that's the case right now, because you can look at your doctor, you can see where they were trained. My orthopedic doctor right now, he went to Harvard and he has treated Tom Brady and Gronowski. So I feel like I'm in good hands because, if he's good enough for Tom Brady, he's good enough for my skateboarding broken bones, right? So this is how it works now. We don't just trust people because the state says so. We have various methods of verification. And, if a doctor is associated with the Mayo Clinic, they spend some time doing, they're attending there or whatever, then, maybe we'll feel better about giving them our business. We'll know exactly what's justifying their cost. They can say, I was trained at X, Y, and Z place. I have tons of experience. Therefore, if you want to be my primary care patient, it's going to cost you $100 a month. If you got another guy who's like, yeah, I just joined, I studied at Florida State and kind of did some local stuff here under an old guy, and I took over his company and my business is $50 a month, you can decide what you need, right? And if you have more complicated problems, if you need a primary care doctor to, check up on your heart every once in a while and make sure he knows that everything is okay and can kind of give you guidance on, diet and nutrition and what you need to do for your heart, well, then you'll find a guy who has that experience, and then that's another way. And he can help you decide what kind of surgeries you need and all that stuff and refer to you certain specialists at certain times. And this is just the way that would be. I mean, it's the same thing that, if you're looking for a car mechanic, you're going to read some reviews about it. You're going to ask someone, hey, is this guy honest? Does he know what he's doing? Is, when he puts new tires on your rims, does he jack all the rims up or like whatever? You just ask someone, and that's how it works now. And, if government got out of the way, we would just expand further.
Dude, the two things I hate the most are finding a new doctor and finding a new mechanic, because once you find one you like and you trust, you stick with that fucker, because you just don't know till you go see them, other than reviews and stuff, obviously. But yeah, man, it's funny you make that comparison there. So towards the end of the video, one of my favorite things about it was these doctors seem like they have really good economics, and I love the way they talk. And the particular example is when this doctor is telling other doctors about this and how he likes it, and their complaint or concern is that, well, what if somebody moves in next door and charges less, and he has a good thing for that. Why don't you tell us a little about that?
Yeah, so this doctor, Dr. Lee Gross is his name. He does a lot of activism, I guess, or advocating on behalf of this business model, trying to make regulations and the laws like tax regulations and various other state regulations more friendly to this model, to try to get barriers out of the way so that they can run their businesses more successfully. And he's a libertarian, so he knows his stuff. He's fairly well grasped on economics, and he's a small government guy, but he's, he has a successful model and he knows what's wrong with the state. And so at the end of the video, there's a really good short explanation of where prices develop in the free market. He's telling this story where he was presenting in Washington at a conference on direct primary care. And, once you hear about this model and once you see the proofs of it, there's no one who can deny it. It doesn't matter what your ideology is. Once you see it working, it's like, okay, this thing provides me with quality healthcare that I need for, a cheaper price than my premiums with my insurance company. So it's just, I can't deny it. And then they'll say something like, and the example he gives in the video is a doctor was like, he raised his hand and he said, what happens if you set up your business and you're charging $75 a month and a guy, sets up across the street and he's charging $60 a month? Well, what happens? Doesn't the price just go down? Like, how do you keep your business? And immediately it's like, hold on a second. We're asking what's going to happen when healthcare prices in America go down. Like, this is the first time we've asked this question in America because they're always going up. It's like, how do we keep them down? Yeah. And so, but the answer is just what we were talking about earlier. The doctor is going to have to justify to the patient why his business is worth more than the other guys, or he's going to have to lower his price to compete. And and that's just the way, that's the downward pressure on prices in the marketplace. And eventually it'll get to, the lowest that people are willing to charge and are willing to pay for it. And, at a certain point, it's just, how can you justify to the people who you want to sell your services to that you're worth buying from? And so it's just a matter of competition in the marketplace. Like, he decides, he values his medical service at $50 a month, and you value yours at $75 a month. And if you can find someone who wants to pay you that price, well, that's the price. But if Dr. Gross couldn't find someone to pay $75 a month, he's going to have to lower his prices in order to find people who said, okay, I wasn't willing to pay $75 when the other guy's 50, but I do recognize you're a better doctor. So if I can get you for $65 a month, all right, I'll do it. And then, that's the way that prices are developed in free markets. And, that's a micro level, but you can just see how, multiplied by all the people acting individually with their own interests, this is how prices develop. And eventually it's just like, what are people buying for it, or what are people paying? Okay, well, that's the price. So that's how it develops naturally. And he puts it really well in the video. And it's like one of the more simple, but I think useful explanations of where prices come from that I've seen. So
yeah, and I just love anytime that, because anything like that, like if you put it in on any other like product or service, it's like, oh, it's an obvious, like you want to monopolize that, like when. And I even have like this kind of conversation when I try to tell people why, like, I don't believe in IP, intellectual property.
Yeah.
And it's like, like, oh, well, because you came up with it, so you should get all. And it's like, okay, so if you own a pizza shop in town, you're the only pizza shop in town, and somebody else comes in and opens up another pizza shop, like, are you allowed to send the government in to shut them down, like, or
right.
go break their legs? Like, everybody recognizes that's evil, so. But you get in certain situations where suddenly they don't recognize it as evil. But when you put it in those simple terms, which it is, and if we go back to like, pizza shops or cheeseburgers, like I can get in town here, I can get a cheeseburger for anywhere from $1 to $10,
right.
and all those people who sell the cheeseburgers at all the different prices all stay in business. They all have their particular markets, their particular prices for a reason, and they all do fine, and nobody's out there breaking knees over it.
Yeah. There's some kind of continuum between, what you want for, a McDouble from McDonald's, or it goes up to, if you want a little bit more, still somewhat cheap, you go to Five Guys. Or if you really want to sit down at some fancy restaurant and get some crazy burger with caramelized whatever and who knows what in it, which I don't like the fancy burgers, but some people do, and they're willing to pay more for it.
I have to pay enough for a burger to where I also have the option to get a beer with it. So McDonald's doesn't offer that, so I at least got to hit the $3 or $4 cheeseburger range usually.
Yeah.
That's my sweet spot.
Yeah. So people always think that, okay, free markets, they'll work for hamburgers. Maybe they work for cars for a certain extent. And healthcare, it's just a different model. It's a different, and they always make these various arguments, and there's all kinds of specific justifications that your run-of-the-mill economist would give, where it's like it's a certain kind of good. You don't get to shop around for it much because
it becomes a moral aspect. Like, how can you deny somebody this medical service? So I think that's because that was my big hang up when I was still like working my way from being a statist, was what about medical? Well, and free market works great for everything, except like my big thing was like, well, like prisons and medical. I was like, that just can't, like, I just couldn't see a way where it was fair and it would work and everybody can, but eventually
once you start to see once you start to see how markets work in other areas that you can wrap your head around, then you can start saying like, okay, well, it's the exact same incentive structure and it's just applied to someone who's selling their services as a doctor rather than they're selling the vegetables that they just grew at their farm. And, it's the exact same incentive structure where if they want people to buy from them, they have to have a decent reputation. They have to prove what they're doing. They have to be able to market their product in a certain way. And it really just does work the same in every single facet of the economy. And the key insight is basically just that if people want to get paid for the things that they are trying to give you, they're going to make sure there's high as quality as possible, not too much more expensive than the other people, maybe higher quality than the other people. And so it's going to work the same regardless of whether it's, you're buying a surgery from a surgical team or if you're buying a new car. I mean, it's the same incentive structures are in place. And if you just start to look at how the economy works, look at how people interact with each other, look at human nature, you can really just start applying these kinds of things to just about anything, and I don't have to have studied direct primary care to imagine logically how such things would work.
Yeah, and I mean, there's any number
but
of
it always is good
tools.
For the run-of-the-mill person to have a working example. And so that's kind of what I see as the value of Reason TV, is to kind of transcend some of the theory sometimes and put it into look at it, how it works in practice. And that helps illustrate it for people when they don't necessarily take all of the same interests in how markets work as someone like you and I would.
Right. And that's where it gets tough because you as well probably are like an economics nerd. So like when you try and to like normie friends or people who just don't care, like put it in those, they just, it just goes over their heads or whatever, obviously economics can be very boring to most people. I get that, but yeah, like you said, when you put it in a way, like here's a real world example, here's a way that it's helping people. Here's, like it makes it harder to deny, or at least they understand there's options. Let's say somebody wants to find a doctor or find, a program like this. Where could is there like a directory or something of doctors that do this, or?
Yeah, the best one that I know of is dpcfrontier.com, and they have a map there where you can just, look at the map around you and see where the closest doctor is. It'll list them on there. I think it's mapper.dpcfrontier.com. And I think there is at least one in every single state except for, I think, South Dakota. So there's a market opportunity for any South Dakotans out there. But every other state, there's tons around, around the Tampa Bay area where you and I are close to. And there's all kinds of options here. But there's all kinds of options most places. So yeah, that's the place to find it. And like I said, you're going to pay somewhere between $50 and $100 a month for this stuff. But usually in a local area, you can look at, the training of certain doctors, and you can see what you want to pay, what kind of specialties, what kind of person it is. You can call them and see if they're nice, see if they have personality you jive with, whatever. And you're actually developing a relationship with the person who is providing you healthcare, rather than just getting a referral from your insurance company because they're in network or whatever.
Probably super advantageous if you have like a family and kids and stuff, right? They probably offer family deals or something.
Family deals, and then it's like there's a certain price for kids, and each new kid is less money than the one before. So if you have a large family, it's like you can basically get like 2 kids for the price of one a lot of times. So stuff like that. It is definitely advantageous for families. So that's a really good point as well. And I might as well bring up, let me see if I have, I thought I had the average premiums. Oh yeah, here we go. So just to illustrate how much cheaper this can be, and how much premiums have gone up. So if we take a single person, the average healthcare premium in the US in 1999 was $2,000. Family was around $6,000. And the average premium in 2018, which is the latest I could find, was $7,000 a year for a single person. And for a family, it was $20,000 a year. And a lot of the times there'll be deductibles close to $2,000 a year for, even if you're paying already for those insurance premiums, you're then going to have deductibles and copays every time you go. So let's just take that average for a single person. And well, even at the expensive end of direct primary care, it's $1,200 a year, right?
Yeah.
So that's already way cheaper than your $7,000 premium for most people. And I know if some people have really good insurance plans, maybe it's cheaper for you to stick with your insurance. But for most people, it's going to be a huge cost saver to maybe get a skinnier insurance plan if you can find one, or just drop it all together, or maybe not use it. So you want to avoid your deductibles and copays and only use insurance for stuff that insurance is intended for. But it is a big cost saver. And I would say as well, a lot of people who do use direct primary care have insurance. And the reason they're using direct primary care anyway is that it's just a better experience. You go to a direct primary care office, they call their waiting room the lobby because no one waits. You go in, you have an appointment, the doctor doesn't need to cram as many people in one day, so they're not overbooking themselves, and you're just going to get a way better experience. You know what things cost. You never get surprise bills in the mail, and you can develop that relationship with your doctor, and you can call them anytime. You can text them. This is another thing when I say they're virtually unlimited access to the doctor. A lot of times you can just call them. You can send them a picture if you got a rash. You don't have to take time off from work and go into the doctor's office and wait in the waiting room for an hour just for them to tell you, yeah, it'll be all right. Get some of this stuff from Walgreens and put it on. You just text them and they say, it's fine. Put some cortisone on it. There's nothing to worry about, and you just have way better access to the doctor, and it's going to be a way better experience.
And just all around, it just seems so much more efficient that way too. There's no need for a whole appointment and this and that, and everybody, you got to drive and just on like the whole of like the entire economy, it just wastes less resources. You just see like all the money that it costs in the regular insurance game. That's just wasted resources. We could be spending on other useful shit. Instead of another medical coder or whatever the hell these people are doing.
You get rid of all the people in the middle who aren't giving you any value, and you just cut them out, and it's just you and the doctor. It's going to cost less, and you're going to have to deal with less people. It's just going to be all around superior.
Yeah, I love it.
All right, let's take a quick second to shout out Agorist Acres Seeds. AgoristAcres.com stocks a variety of seeds for your garden or homestead. They also have really cool packaging instead of those silly paper envelopes.
Buy seeds with crypto, support the counter economy, and become self-sustaining today. Agorist Acres offers fast shipping, so you can get started right away.
Make sure you use code Nexus10 at the checkout for 10% off of your orders. Also, they will donate a portion of the sale to Agorist Nexus, helping to bring you all the great content you expect. And all right, let's get on with it.
So let's move on here real quick before we go. I did want to talk a little bit about some other economic stuff. So yesterday you did a Q&A with Patrick Newman. And if the folks listening are familiar with Patrick Newman, I always forget what school it is he works at because there's so many colleges in the Lakeland area. But he was the one, he did a lot of work on with Rothbard's books, right? Like he deciphered Murray Rothbard's handwriting. So he's been able to help put out a lot of books posthumously from Rothbard, one of which that I read was The Progressive Era, which was great. I highly recommend it.
That was one Patrick edited, and then he pretty much just revived from Beyond the Grave, Rothbard's 5th volume of Conceived in Liberty, which is his early American history. So he did, I think, he continued through the Constitutional Convention, I think through 1787, and that was the end of the 5th volume. But during his life, the 5th volume was never published. So it was Patrick kind of dug up the original manuscript that Rothbard had written by hand and deciphered it. I mean, his handwriting, Patrick showed me scans. It's worse than you think it is. It doesn't look like a language. I don't know how he figured it out, but this is, so Patrick is a fellow at the Mises Institute, and he's one of my good friends. He lives in Tampa, and he teaches at Florida Southern. So he does
Florida Southern. That's right. Yeah, I always want to say Southeastern.
So people will know him as involved with the Mises Institute. He has a book coming out this year on it's a economic history book about cronyism. I think it goes from Jamestown up until before the Civil War. So it's like most of early American history, and then through the mid 19th century, the history of cronyism. So
that's interesting because I've heard a lot of I'm sure in Rothbard's Conceived in Liberty books, which I have not read, he talks a lot about this. But I've heard a lot that even just the founding of the United States, the Constitution and stuff was a big cronyist kind of move. And I mean, anytime I see any regulation or any government action, I'm like, where's the cronyism? Because it's always there. Whether it's on purpose or not, it's just the nature of what government does.
They have to get their advice from someone, and who's it going to be? It's going to be the most powerful people in society, and usually that's gonna.
And I mean, to be honest, even in the best scenario, okay, let's say we do have this thing, and we need to make some sort of plan for this food shortage or something. I mean, who would you consult? The big food producer. So I mean, even if you're not evil, it's just the way that it works when you try to have a centralized solution. It's just the way it works, man. So
if you have that power to stifle competition or whatever, or write the regulations to be favorable to how you already operate your business, Well, that's just how it's going to work, and there's really no way to avoid it. So that's
even if we say people are doing, like, even if they're trying to be fair and whatever, it's just, I mean, it's just the way that it's going to work out, unfortunately. And it's the whole, we just get the right people in there, we just educate the kids good enough to vote the right way, and well, then why even bother? Why don't you just be a dictator?
Yeah, that's the and that's the case with the medical insurance too. It's just it's so crony, so much influenced by government, so much regulation, and the main thing I should probably just put a neat button on this as to why direct primary care is so much more free market, because like we had already established, insurance is totally free market. So, some people might just say, look at all these private insurance companies, they're ruining healthcare in America. This is why we need single payer to get all these people out of the way, consolidate it, be more efficient if we have government. But no, in fact, the problem with the insurance in that situation for using everything is that it totally distorts prices. But there are no prices. When you go to a regular doctor, you don't talk about prices. And if you bring it up, the doctor's like, I don't know how much it's going to cost. I have to ask the insurance company, And so with the direct primary care, they're making a real market in healthcare where what things cost, prices, you can compare. And this is the fundamental thing in an economy, is the price system. I mean, it's what makes socialism impossible, is lack of prices. So this is absolutely key, that what direct primary care is doing is reintroducing prices back in healthcare where they had been kind of consumed by Medicare and the insurance companies.
Yeah, it's that's the issue with socialism and communism and stuff, like the price thing. I mean, that's how you gauge the usage of resources. It's the only way you can make decisions, and in any way, anything the government does is going to distort those prices when they subsidize one thing or regulate it. It just so it even like at the consumer level, it makes people not be able to make correct or knowledgeable decisions about the items that they're buying, because the prices aren't what they should be. And when you just see it, it's just so maddening, it's everywhere, So one of the reason I wanted to bring this up, you guys did this Q&A, and it was a lot of it was a really good, basic economic, talk. It was really great. I really enjoyed it. Like I was telling you before, I really need a good refresher from time to time, but there was some interesting, I don't know, maybe a little more philosophical kind of ideas about it that I wanted to talk about, because these are things that I think about as well. So basically, like, on my end, like, I love Austrian economics. It's the way it helps the world make sense to me. Like, it makes sense. Markets, the way nature works, it all sort of ties together for me. And maybe I'm just weird, but it just does. But I also, I believe in freedom and liberty and etc. And those two ideas just jive 100%. So I always kind of have to wonder, is it like, am I choosing that economic, outlook as, let's say, opposed to, Keynesian or something, because it jives with the way I feel the world works? Because I definitely feel like that's why people choose to be Keynesian, because it jives with the way they want the world to work, or whatever. Do you see like parallels like that, like me, or I don't know? Can you make sense of anything I just said?
Well, we should definitely be concerned about that. We should concern ourselves with the question, is what I mean. We should say, do I think that Austrian economics is correct because it's the proper way to understand the world and how it works? Or is it merely just me confirming my bias with these elaborate theories, and just to already support what I've decided that I believe? But I think with Austrian economics, the way that that you are attempting to understand the world as it actually is, without regard to your values or your ideology, is that economics is not a tool to tell you how things should be. It's a tool to tell you how things are, the nature of how things are. And so in economics, we would say it's the nature of what happens given that people act. So in Austrian economics, everything is deduced from one axiom, basically, in the Misesian tradition anyway. And it's the action axiom. It's basically that human beings act with scarce resources to achieve their desired ends. And then you can, from that, deduce economics, the whole of economics, just by logical processes. So in this way, economics is value free because you're just looking at a statement, the action axiom that is, as far as I am concerned, and as far as Mises and his followers are concerned, they see this as irrefutable because in the effort to refute it, you are contradicting yourself because you have to use scarce resources, namely your time, your breath, the calories you consume that you're burning while you're using your brain to make arguments. You're a human being using scarce resources to a desired end. And so this can't really be refuted without contradicting yourself. And so given that Austrian economists would say this action axiom is true, and we know it's true, then we can deduce everything else from that too. And as long as our logic is sound in the way we're coming to these conclusions, then we know that it's just a priori true without having to verify it, look at data, anything like that. And so when you have a theory like that, you have Austrian economics, and you can think logically through the way the world works, you can make sure that you're logically consistent. And this is not as a result of the conclusions you're making, but rather the conclusions come from the thought process. So you're able to think through the economy, think through what people do and why. And you don't have to get bogged down with saying, well, we have this state and we need to justify the use of this state. So we're going to come up with theories to make sure that, well, okay, if we spend money in this certain way, we can justify this because it provides X, Y, and Z benefit. No. So that's not the way that Austrian economics works. And I think that I would argue that the Keynesians are just like yes men for politicians and that they're kind of fake economists. And I think that's kind of one of the way we can actually differentiate it, because we have a solid theory that we know axiomatically is true. And as long as we're being coherent with our logic, well, we know that the conclusions we come to as a result of that logic can be trusted, because we're still being consistent with the original assumptions.
Well said. Yeah, I feel that a lot of people, but the economists or not, but they fall in with the Keynesian. Feel like I'm saying that wrong.
Yeah, Keynesian actually.
Keynesian.
Yeah, John Maynard Keynes.
Economic class, just because it's like people want to be able to fix problems. I mean, that's what we want, and it's really hard to kind of sometimes have a thing where it's like, well, that's just the way the world works, and you only have so much power in yourself. But like, yeah, with the Keynesians, it's like, well, no, we can, with this tariff or with this subsidy or with this whatever, we can make the world in the image we want it to be, and I think it's hard to let go of that. I think that's one of the big things about freedom and why it's really difficult for a lot of people. And a lot of people actually don't desire it, is because it can be scary, not having that level of control. I think once you get over that, it turns into being a beautiful world. But but yeah, it's always something that I just sort of notice. It's the more control freaky kind of people who are like, no, you see, we do this and that, and the regular people are too dumb to know how it works, so we need this group of smart people to control the whole economy. And I'm just like, they're the same people.
The way I think about it is just that economics describes things as they are, and libertarianism, broadly speaking, describes things as they should be. So good economics in that way would be value free, right? And then you would apply your values to economics and say that if I do X, I will, the result of that will be Y. So if I'm trying to get Y, then I should do X. And so if you apply your values to the economic process or the economic method, in my opinion, if you're not, if you believe that violence is wrong, and you don't think that we should steal or hit, or, we don't think you should hurt people or take their stuff, well, then you arrive at libertarianism, and economics can lead you to that conclusion that would say, I have these values, and if I apply these to the economic method, I can know that if we apply these values to the economic method, these are the results we'll get. But economics doesn't tell you that the results you're going to get as a result of these actions are good, right? Economics can't tell you if the values you're seeking are worth seeking. It can only tell you what might happen if you do indeed do the things that we're talking about, right? So if you say, if your value is to say, we think it's good that we should have higher wages, so we should raise those wages, right? And we could raise the minimum wage, is what I mean. So if you think it's a good thing that we should have higher wages, you might say, well, we need to outlaw low wages. But economics can tell you that that's not what's going to happen. So if you want higher wages, economics will be able to tell you that the way to do that is not through a minimum wage. But if for some reason you wanted to, let's say the original purpose for the minimum wage, which was to keep competition away from white people, then you would say, okay, we need the minimum wage because the result is going to be, it's going to leave blacks and Asians who compete with northern white labor, they're going to not be able to compete, right? Because it's illegal to hire them at the wages that they're able to get voluntarily. So you could say in that way that, like, if your value is to protect white labor in the early progressive era, well, then you could use economics to say, well, the minimum wage is a good thing because the thing that I want to do is to discriminate and to protect white wages. But if you think that we should just pay people what they voluntarily can earn, that will be the way to raise wages. Well, then you would use economics to say, okay, if we want to raise wages, this is what we'll do. But it won't tell you what's good, if that makes sense. You know what I mean?
Sure. Yeah, I mean, and then we have to start getting into the whole, well, what is good and blah, blah, blah. And that's a whole story for another day.
Exactly.
Too.
And that's a question. Yeah, that's an ethical question. That's a political philosophy question, but it's not actually an economics question, right? Because economics can't tell you, can just tell you what things are and how things work. It can't necessarily tell you. It's all about trade-offs, right? It can't tell you what's good. It can't tell you what you value and what you should trade off. It just it's a method of understanding the world to tell you what the trade-offs are and to think through things, but it won't tell you what trade-offs you should make.
Excellent. We're going to go ahead and wrap on that, man. This has been great, dude. Thank you so much for coming on.
Yeah, I really appreciate it.
Is there anything anywhere that people can find you, or anything you want to plug, or final thoughts or anything? Go ahead and go for it.
Well, you can subscribe to Reason TV. I think that Reason TV does a lot of solid work, and it's a lot of times we do work that is good to share with the normies because, like we were talking about today, we have practical examples of freedom working, and I think we tend to do a pretty good job with the production and everything. We're a very professional outlet with really professional standards, and pretty much everyone who works for Reason TV is a fairly radical libertarian. So you're going to get a lot of good content there. So subscribe to Reason TV on YouTube and Facebook, Instagram. You can follow us all the regular places. We're just on the main feed of Reason on Twitter, and you can follow me on Twitter. I use Twitter fairly liberally, fairly honestly. Try not to get too crazy, but I am on Twitter. You can follow me, Osterhoudt John. John Osterhoudt was banned, so it's Osterhoudt John. And so yeah, that's where you can find me.
Cool. And we will link to that video as well. And it is a good video, especially like you said, to share around, like on your personal, where your aunt and shit like that will see it. Cause it's a really all around video that any normie could watch and not be like, this is biased bullshit. So I think it's pretty good.
And the other thing too, if you watch that video and you like it and you want to hear more, I also have a full interview, written transcript of the interview I did with the main doctor of that direct primary care service. And you can read the entire conversation that I cut from to make the video. We have it in writing. It was in the July issue of Reason Magazine, and it's online as well. You can find it. If you just, maybe I'll give you the link to that. You can put that in the show notes as well.
Yeah, I'll put it in there. And then we're good. So we're going to take her out on a quote. I think this one's relatively poignant for our conversation today. When you want to help people, you tell them the truth. When you want to help yourself, you tell them what they want to hear. Tom Sowell.
Exactly.
Agorist Nexus.
Yeah.